My mother, unfortunately, had died of cancer, and I take my cancer screenings really seriously as a result. So I went in and had my mammogram done, and I could tell, even by the looks on their faces, that this was not good news. 3 days later, unfortunately, I found out, in fact, I did have invasive breast cancer. It was a nightmare. I was almost the exact same age that my mom was when she died, and I thought, I do not want this to be my story. I knew that surgical intervention was going to be necessary. I didn't know how advanced the cancer was, so it was very important that as quickly as I could get that out of my body, I wanted it out. Less than 3 weeks after my diagnosis, I got in. It wasn't too long after that I found out that traditionally someone in my situation would have had to have had 2 surgeries. While I was on the table, they checked my margins, and the cancer had spread a little further than they originally thought. Because of that, they were able to go back in and remove what was left of the cancer.
As a surgeon, it's a very personal relationship you have with a patient. I mean, ultimately, I'm doing an operation on someone. It's something that binds us forever. So you take it on yourself, and you want to ensure that you never fail the patient. So the same amount of anxiety they have is the same thing that I feel as I open their pathology report. You know, I'm like, is he going to be okay? Every time someone has to get their margin revised or need a second operation, all that does is delay when they can start their adjuvant therapies. So that's a huge responsibility that you take on to yourself. And there's my responsibility to the healthcare system.
Early breast cancer can't be necessarily felt or seen by the surgeon in the operating room. The search for the target that the radiologist might have picked up, that the patient couldn't feel, that is invisible to us all, really required the solution of the addition of X-ray technology in the pathologist's hands as a tool to find and confirm the removal of early breast cancer that the radiologist identified. It was always the gold standard that you'd really have to wait a week before the pathology came back and success could be declared. So we've upped our game by creating a pathology lab that can do more to help and guide the surgeon.
We've got the technologists, we've got us as radiologists, we've got the surgeons and the pathologists all working together in a short period of time to make sure the loop is closed. Most often, the tumors that we're putting wires into are small, so the surgeon can't feel them, can't see them, and needs my wire. So I put the wire in, send the patient down with diagrams of what I've done. He'll take the area out, and with the pathologist in the OR, then they can do that X-ray specimen. With my note and the images that we've saved in our packs, they can look at it together and see whether they've got the area out and whether more needs to come out.
As a surgeon, we make multiple different considerations, such as how long is the patient going to be under anesthesia, how that impacts their risk of infection and other things. So the fact that I can stay scrubbed in doing the operation in real time and have my colleague come into the operating room, take the specimen from me the way that I've handed it to him, walk across the hall, and if he wants to ask me a question, it takes me 2 minutes to go see him and come back. There's been minimal risk to my patient, minimal increase in surgery time. That quick interaction and feedback makes the world of difference. So having that close proximity helps us benefit the patient as well as benefit the healthcare system. It doesn't seem like much when you come for a short surgery, but really the cost is around $10,000 to $20,000 from the healthcare system. So if we're able to put that cost elsewhere towards a different treatment, then it really saves us all a lot of time and resources.
So when we're more precise with our surgery this way, using this platform, we can avoid reoperation and all the knock-on delays that affect other patients in the system. We're picking up these cancers earlier. We can now do breast conserving surgery with smaller and smaller operations to jump in earlier. And so there are just successes built on successes. In your case, here's your mammogram. And just zooming in on it, that's what the radiologist sees.
I'm happy to report that it's been 2 years and 2 weeks since my surgery, and I'm feeling great. I'm like training for my first marathon, and it's going well. I'm getting my speed back, and I'm feeling wonderful. And my husband and I feel like we're able to put this behind us. We're really actually able to be positive about the experience. I just appreciate a lot of things in life a lot more than I did. I'm living my life to the full while I've got it, and I'm taking full advantage of having the health that I have. I'm so grateful that there's people that do this, that save lives every day, and that do it because they care. They're not doing it for a paycheck. They're not doing it for any other reason, and I truly, truly appreciate them for that.